Hi and welcome back. We are the team at Gender Plus, and today we are going to talk about autism and gender diversity. My name is Paul Carruthers, and I'm the nurse consultant and manager of the Hormone Clinic at Gender Plus. And I will hand over to Claudia if you could introduce yourself.
Yeah, hi, I'm Claudia, and I'm a clinical psychologist and systemic psychotherapist at Gender Plus.
Hi, my name's Aidan Kelly. I am a clinical psychologist and the director at Gender Plus.
Thank you both. Okay, so I know there is a lot of talk about autism and neurodiversity in gender fields, and should we just jump straight in and just have a little chat about this and share our thoughts with the audience that might be listening today?
Mhm.
Okay, so I've got a question then for both of you. Studies do show an overlap between autism and gender diversity. Is this your experience of treating people here at Gender Plus and previous in other jobs?
Yeah, absolutely, Paul. I'm happy to jump in on that one. Yes, I guess we do see that clinically as well, that there tends to be a much higher uh, prevalence of neurodiversity in general, so autism, ADHD, dyslexia, dyspraxia, these sorts of conditions that fall under the neurodevelopmental umbrella, in the kind of in the population of the people that tend to come to gender clinics, and Gender Plus is no different in that regard. So yeah, it's very much there. I guess what that means, I suppose we'll probably talk about in a minute, but I guess it's one of those things that we would be keen to identify and think with a person about whether there are some of their needs that they might need to get that might be better met if they had a better understanding of whether they had that diagnosis or not. So potentially an additional assessment for that sort of thing. But yeah, I don't know what you think, Claudia.
So what I want to add is that neurodiverse people also have a higher prevalence of identifying on the LGBT spectrum more broadly. So it's not just about the overlap of kind of trans identities and autism. It's also autistic people are more likely to identify as non-heterosexual as well.
And why do we think that might be the case? Have you got any thoughts on that? Or is it's that kind of question that we'd all love the answer to, but interestingly just to hear what you guys think about it.
I'm not sure about you, Aidan. I guess I'm thinking we always have to be a bit cautious when we ask about causality because sometimes that can be misused and to kind of invalidate trans or autistic people's experiences. But there are some people who would say that autistic people are less prone to kind of follow social norms or follow social conditioning, and therefore are much more likely to question gender norms and therefore also more likely to question their gender identity. So I think that could be one of the contributing factors of why we might see more neurodiverse people presenting to gender services. What do you think, Aidan?
Yeah, I think even some people I've worked with who are neurodiverse have told me that, especially those with an autism diagnosis, have told me that actually the the kind of the social pressures to perform or behave in certain ways that may be neurotypical, so people who don't have an autism diagnosis might pick up on a bit more and be a bit more sensitive to, they might have been less kind of aware of, and they would have even it's quite a common thing for people to tell me that actually I was oblivious that I was perhaps different in that way, and so actually they don't see, and they see their kind of neurodiversity as allowing them to express their true selves without the burden or the pressure to conform quite as much. But really, it's, that wouldn't be the same story for every neurodiverse person. But I guess that's quite a common story that I would hear, and so that seems important. I suppose the social kind of the nuance of so performing certain social tasks and social roles seems to be experienced differently by those people who are neurodiverse, I suppose.
Mm.
And do you think it's helpful for somebody to be diagnosed with autism to before they go through a gender assessment, or do you think it has no relevance at all? There's certainly some people out there that are saying that, at the point of referring to a gender service, they should go away and have an assessment into their neurodiversity first. What do you think about that?
When I start a gender assessment, I start off broad and trying to understand all aspects of life, and tend to, especially with those under the age of 18, quite early on, take a developmental history, so early history about their early years, and would have, of course, with our questionnaires that we send out in advance of our first assessment, screening for things like neurodevelopmental difficulties, would certainly have that in the back of my mind about whether that might be relevant to that young person's experience. But it's really about a kind of a needs-based assessment. Could this person potentially get their needs better met if this part of their life was better understood? And so there are plenty of people who would have autism who are functioning well and doing fine in life, and so I wouldn't be suggesting or overly kind of pushing referral for those people. If they're well supported and doing all right, well then that's fine. It's not my job to kind of pathologize people. But if there's a clear and apparent kind of need or element of difficulty or distress that could be attributable to a neurodevelopmental condition, and they may benefit from having an assessment to clarify that, which may then lead on to certain interventions to support that particular issue, well, then it would be my duty as a clinician, even though gender would be our kind of main reason for engaging, it would absolutely be important and right that I would then suggest and signpost people to potentially undergoing that assessment process, really. I don't know what you think, Claudia.
Yeah, I agree with you, really. I don't have anything to add. I think that was quite a comprehensive answer. Yeah.
And I agree, and I think to throw my 2 pence in would be that an assessment into neurodiversity shouldn't delay an agenda assessment. And I think what the beauty of Gender Plus is we've got a full integrated team, and it's something that we can offer at the same time of coming forward to a gender assessment. I think it may be difficult in other services in the public sector, certainly, to sort of not accept a referral for somebody to go away to CAMHS, for example, and have that explored and have that gender assessment delayed. I don't think that would be fair or in the best interests of a young person. Okay, well, how significant is this then in terms of establishing a diagnosis of gender incongruence?
Well, I think for me, it's more significant when I meet with the young person and kind of how I engage with the person I work with. Sometimes if someone is autistic or neurodiverse in other ways, we might think together how we might structure the sessions. Some autistic people can get very nervous or anxious about meeting new people or new clinicians and might be worried about what we might cover during our appointments. So I guess I would try and kind of to minimize that anxiety and offer as much predictability as I can during our appointments. So I might kind of share the topics that we will cover in advance and give them a choice to select, what they want to talk about during which sessions. So it's something about, I guess, kind of adapting communication that's available to the need of the young person that we meet.
Yeah. I think in addition, that one of the helpful resources that we have, if people come for in-person appointments, we have pictures of the front of our building, inside some of the clinical space. I think sometimes, especially some of our kind of autistic clients, they can be quite anxious, as Claudia kind of referenced, and so having visual kind of representation of what it'll be like when I get there, the sort of environment I'll be in, that can help to manage that. So I guess we're attuned to those sorts of needs is particularly important, really.
Yeah, great. And I think the clinicians in Gender Plus have lots and lots of extensive experience of working with young people that might be neurodiverse. And I think that's a real positive that we bring to the field. But swinging back on a positive, what might be any associated challenges then for both as a clinician and maybe for the young people? I know you've briefly talked about what it might be like for our patients coming forward if they're anxious, but maybe we could just think about that a little bit more for them and also what it's like for clinicians.
For autistic people, sometimes of course, they experience the world in a slightly different way, but obviously have the same emotional responses to different things. But how they then interpret and communicate that sometimes can be a bit of a challenge. And so when we're asking people to think about and to explore some quite sensitive and complex issues related to identity, experience of body changes, social experiences, and other gender-related experiences, it can be sometimes a challenge to kind of verbalize and communicate that. And so really trying to understand the parameters of what feels comfortable and possible for someone to build up a relationship and to have someone in a comfortable environment and where their kind of anxiety is kind of at a pretty low level, hopefully. And it kind of increases the chances of you being able to kind of have that kind of dialogical exchange, that conversation with someone where they can find the words to express themselves as kind of accurately and as comfortably as possible. But yeah, there are other means like drawing or writing things out, or sometimes emails, exchanges, or different sorts of ways to do that, to try and access that young person's kind of internal world and thoughts, really. I don't know what you think, Claudia.
Yeah, I would agree with that. And how also it plays a role is when we think about decision making. And so some or many of the young people we see want to access, for example, hormone treatment, and that involves then kind of holistic developmental assessment. And part of that, where indicated, might be part of the work might be to think about decisions of going forward for hormones. And I think with some autistic people, they might find it harder to project themselves into the future. And that's, for example, really important if we have initial conversations about fertility, for example, they might find it hard. I mean, pretty much like other adolescents as well, to kind of project themselves into the future and imagine what they feel about parenthood. And so it's really important to break things down and make them more concrete. And so often I think the conversation can be about whether they want to keep options open for fertility preservation or future fertility, rather than just imagining themselves if they want to be a biological parent or not. So it's, yeah, kind of making the information accessible and making it relevant to the here and now is really important, I think. Yeah.
Yeah, thank you. I mean, you've talked there about sort of accessing hormone treatments. I don't know if we want to spin it around a little bit, if you've got any questions for me, if we think about what things we might need to think about when anybody with autism might come through to see me in the clinic.
Yeah, how might you work differently with someone or not when you know someone is autistic, Paul?
Well, I think it's important to know if somebody is or not. But what I want to sort of point out, firstly, obviously, it's a spectrum, so that could mean different things for different people. But also, there should never be a barrier to healthcare, no matter, when we look at autism or any sort of learning difficulties or disabilities. So, but it's always good to know so we can adapt our model of practice. So before a referral comes through, I always ask if there is a diagnosis, or there may be, even without a diagnosis, is there some thoughts of some neurodiversity? And then we build up a holistic package of care for their first appointment. Do they need an extra long appointment because there might be some anxiety? Do they need to be in a quiet waiting room? Do we need to be providing sensory toys, which we do anyway at Gender Plus, but do we need to provide some more? And how might they communicate with me in clinic when we're taking informed consent? They may feel that it's quite overloading just talking one-on-one, so we may communicate in various ways using flashcards or handwriting things. So I think, yeah, so it shouldn't be a barrier, but we do need to make some adaptations depending on how they may present in clinic. Okay, so I think to conclude, I think what we've made really clear is that no one person is the same, and we take everybody as an individual, and we create bespoke packages of care here at Gender Plus, both in the psychosocial side of things and in the hormone clinic. So I hope you found this interesting. You'll be able to listen to us on our YouTube channel as well as our podcast. And for more information, you can go to www.genderplus.com.